Because my parents lived during the Depression and my mother never went to college, they really wanted their children to be able to do better than they had done. They really did emphasize that dreams should be limitless and we should be able to achieve whatever we set our sights on. My parents were first-generation American. I was born outside of Philadelphia. We had a lot of support from our parents to go to school, to be able to pursue our dreams. My first foray into college was at a place called Shippensburg State College. I really had not been someone who wanted to be a nurse my whole life. And when I told my mother's mother, who lived with us, that that's what I wanted to do, she said, "Why do you want to take care of all those old people?"
Her first job was at the University of Utah Hospital, and then she moved on into a nurse manager position, still at the University of Utah, and so her early career launched there. She did her master's work at the University of Washington, and then she returned to Utah.
I had finished my master's, so I took a position where I was the adult ICU clinical nurse specialist.
She made the choice to pursue her doctoral studies at the University of Utah, which is not something that any of us take lightly.
When you like the friends that you have, when you like the people you're working with, and you like the place where you live, it really does influence your decisions. And so I was very fortunate to be able to finish my PhD at the University of Utah. The skills that I learned in my research and in my doctoral program were really extremely beneficial.
Her biggest career move, I think, was moving to the University of Virginia.
At the University of Virginia Medical Center, we worked on stabilizing the workforce, but also really looking at how could we be more efficient. A lot of my influence was to enhance the collaboration across disciplines, as well as put into place a number of measures that really utilized a number of systems to make care safer.
Several years ago, while serving as a consultant, she recognized that she wanted to continue to give back to her profession in the most profound way and began exploring the idea of serving as the president of the American Nurses Association.
The American Nurses Association is the largest association of registered nurses.
She went to run for the presidency and was elected to the presidency. One of the most prestigious roles in nursing is to be the president of the American Nurses Association.
And that is really a premier role to be able to represent nursing in this country.
Part of the work that we do is around advocating and supporting registered nurses in order to improve their practice.
And we represent the interests of 3.6 million registered nurses in the country.
She does everything from public speaking to representing nurses in the media to directing the activities of the association.
So the American Nurses Association really is the foundation for professional practice. When the White House wants something about nursing, it's A&A who they call.
Just a few months into her presidency, the nation was faced with the Ebola crisis on our shores. Not even being very well oriented to her role as a president, she fully stepped into all of that and directed that work in a way that kept great clarity on nursing practice and its important impact on patient care.
Probably the greatest joy that I get is in cooking. I love making not only Italian specialties, but probably just about any other kind of food. Love to experiment, and fortunately have a family that is willing to be subject to that. My husband is a physician, and I don't hold that against him. Not only I, but my husband as well, are very proud of our daughters. They've demonstrated that they can follow their dreams too.
Pam's career spanned 40 years of service to nursing administration, to the professional associations.
It has been a great career. I've always been satisfied and very grateful for my choice, and have had benefit of, again, education that has allowed me to advance my career.
She's been named several times as one of the top 100 most influential people in healthcare and one of the top 25 most influential women in healthcare.
She's easy to work with, a great thinker, and just someone who wants to contribute.
The work that she does gets recognized as being both impactful and influential in changing the quality of healthcare in this country.